Hello, and this is my presentation on facial scapulohumeral muscular dystrophy, also known as FSHD, and other types of muscular dystrophy. Did you know that I myself have muscular dystrophy? I have FSHD, and with that entails a whole lot of ailments and a disease that is degenerative and eats muscles. So let's begin. This presentation today that I'm presenting to you, as I've already told you, is about muscular dystrophies and different types of muscular dystrophies. One in particular that touches home with me is FSHD. There's a lot of information we're going to cover, and I'm asking you that you hold your questions until the end. My job today is to educate you on FSHD so that you're better prepared to handle everything that you're going through. Let's first talk a little bit about muscular dystrophy and its history. Muscular dystrophy occurs worldwide, affecting all races and both sexes. Muscular dystrophies, or MD, are a group of inherited conditions, which means they are passed down through families. They may occur in childhood or adulthood, cited Mayo Clinic. The word dystrophy is derived from the Greek word dys, which means difficulty or faulty, and troph, which means nourish. There are approximately 60 separate diseases which can be classified as neuromuscular disorders, all of which involve our progressive and irreversible wasting of the muscle tissues. These disorders vary in age of onset, severity, pattern of affected muscles. All forms of ND grow worse as the muscles progressively degenerate. Example, 7 years ago, I was diagnosed with FSHD, and over that span of 7 years, my right arm, bicep to be more precise, has wasted away to practically just bone and skin. So yeah, that's an example of atrophy and the degenerative of the muscles. MD, also known as muscular dystrophy, is not contagious and cannot be brought on from injury or illness. Facial scapulohumeral muscular dystrophy, FSHD, is one of the 60 different muscular disorders and will be the focus of this presentation today. Now let's learn a little bit about the history of muscular dystrophy. The first historical account of muscular dystrophy appeared in 1830 when Sir Charles Bell wrote an essay about an illness that caused progressive weakness in boys. 6 years later, two scientists, Conti and Goja, reported on two brothers who developed generalized weakness, muscle damage, and replacement of damaged muscle tissue with fat and connective tissue. At that time, the symptoms were thought to be signs of tuberculosis because it was very common at that time. So they did not receive full credit on the discovery of muscular dystrophy. It wasn't until 1868 when Guillaume Duchenne, excuse me if I didn't pronounce the first word right, gave a comprehensive account of 13 boys with the most common and severe form of the disease, which now carries his name, Duchenne muscular dystrophy. With Duchenne's application of Freudism, the use of electric currents stimulate muscles and nerves, in the treatment of neurological disorders, it soon became evident that the disease had more than one form and that the diseases affected people of either sex and of all ages. Muscular dystrophy can be classified into 9 groups. Incidence rates and severity vary, but each of the 9 categories causes progressive skeletal muscle degeneration. The disorders are classified by extent and distribution of the muscle weaknesses, age of onset, the rate of progression, severity of the symptoms, and family history. The 4 major forms of muscular dystrophy that begin in childhood are Duchenne muscular dystrophy, Becker muscular dystrophy, congenital muscular dystrophy, and Emery-Dreifuss muscular dystrophy. Duchenne MD is the most common form of muscular dystrophy in children, and it only affects boys in this case. It appears between the ages of 2 and 6. In most Duchenne MD cases, the arms, legs, and spine become progressively deformed, with severe breathing and heart problems later in the disease. Those with Duchenne MD usually do die in their late teens or early 20s, which is sad, but that's what it is. Becker MD is similar to Duchenne MD, but the disease is much milder. It commonly, too, affects just boys, and it can appear between the ages of 2 and 16 instead of 2 and 6, but can appear as late as 25. Congenital, meaning present at birth, MD, progresses slowly, affecting boys and girls alike. This disease causes muscle weakness at birth or within the first few months of life, along with severe and early contractures, which means shrinking of the muscles that causes joint problems. Emery-Dreifuss MD affects primarily boys and is usually apparent around the age of 10. This disease causes slow but progressive wasting of the upper arm and lower leg muscles. There are two major forms of muscular dystrophy onset in youth or adolescence: FSHD and limb-girdle MD. Limb-girdle appears in teens and early adulthood and affects men and women. Limb-girdle also causes progressive weakness that begins in the hips and moves to the shoulders, arms, and legs. Walking can become difficult to impossible with this disease. Since FSHD is what you're diagnosed with, it will be covered over the rest of this presentation, or what I was diagnosed with. We will begin talking about it in depth on this next slide that I have. FSHD, also known as Landau-Digerin disease, is a neuromuscular disorder. It is the third most common muscular dystrophy among the 60 different varieties of it. The name comes from facies, the Latin word and medical term for face; scapula, the Latin and anatomical term for shoulder blade; and humerus, the Latin and anatomical term for the bone that goes from the shoulder to the elbow. Symptom onset usually occurs in adolescent and early adulthood. Symptoms can become apparent as early as infancy or childhood, but this is very uncommon. Although disease course may be variable, FSHD is typically characterized by relatively slow disease progression. Specific symptoms and findings may vary in range and severity. Because FSHD is a disease that usually progresses very slowly, it rarely affects the heart and respiratory system and isn't considered life-threatening, and most people with FSHD will live a normal lifespan. So, in closing today, I hope that you've learned a little bit about FSHD and muscular dystrophy in general, and know that it's a genetic disorder that currently does not have a cure. The muscles of the face, shoulders, upper arms, lower abdomen, and lower legs are what are particularly affected and afflicted by FSHD. My muscles will gradually get weaker and deteriorate in these areas, and the disorder can also cause problems for my hearing, heart, breathing, and spine. My body is constantly working to maintain equilibrium internally. Treatments for my disease will vary depending on how severe my disorder gets, and they can range from anti-inflammatory drugs to different devices that I'm going to have to wear. I really hope that with this presentation it has been very informative, has answered any questions that you may have had or will have on muscular dystrophy, and there are some resources in the next page's slides that I've made that I have found to be very resourceful pertaining to FSHD and muscular dystrophy.